Okay, so I'm speaking today about sexual health and human rights, which means the relationship between sexuality and human rights, to understand in what sense sexual freedom should be considered as a human right, and to understand if the medical practice regarding sexuality is also a human right, or if is a violation or a contradiction with the human rights. So the discourse of sexual rights has progressively emerged since the late 60s in the United Nations. It started in 1968 at the Tehran conference with the reaffirmation of the right to decide whether or not to have children and how many children. So it is very important to note that sexuality entered in the field of human rights as reproductive sexuality. And progressively, in various conferences of the United Nations, the question of having a sexual life without risk of violence, discrimination, and pleasurable became progressively a human right in the Beijing Conference on Women and also in the ICPD Conference of Cairo, which was in 1994. So at this time, in 1994, in Cairo, sexual health and pleasurable sexual life became part of human rights. But as we can see, if we observe the world nowadays, dimensions like contraception, the right of abortion, the possibility to be homosexual, the question of transgender and transsexual, all these problems are not yet free of risk and discrimination and violation of rights. So we can say that even if it is now taken for granted that sexual rights are part of human rights, they still need to be implemented in various countries, and not only in the countries of the East or of the South, but also in European countries. Thank you.